Our next guest is Dr. Jennifer Bondy, the president of the Essex County Medical Society. Thanks for joining us today, Jennifer.
Thank you so much for having me, Rob.
Tell me, how are you and your family doing in these difficult times?
We're doing okay, thank you. We're trying to observe social distancing like I think most people are at this point. So things are certainly a little different than the regular day-to-day, but we're getting through it like everybody else, I think.
Yeah, it's pretty difficult, especially with Easter just passing. It was social distancing is so important for everyone. So it was difficult.
Absolutely.
Difficult, but we'll get through it. So tell me, how has COVID-19 affected you and your patients?
Well, there have been a lot of impact. There's been a lot of impact on my practice. I'm accessing patients through virtual means now, like a lot of providers are, meaning that unfortunately I'm not able to see most of my patients in person as I normally would, but I have been able to keep in touch by using virtual communication. So the telephone, for example. The internet's a wonderful thing to be able to allow us to access our patients and the entire system. So it's going okay, I think.
I understand that there's been a map developed for patient care. Can you tell us a little about that?
Yeah, absolutely. So, I mean, like I just alluded to, medicine, like many industries, is no longer able to offer services in the way that we're used to being able to access them. But there is a map now available because we want members of our community to know that we are continuing to offer services in a different way, by telephone and by video visits.
And is this for all of Essex County?
Yes, it is. It's for the city of Windsor, and it's for all of the communities across Essex County.
Excellent. So what was the rationale in some of the development of the map?
So with the development of the map, part of what happened, I mean, this took us by a little bit of surprise, like I think it did most people. We didn't expect this to come quite as hard and quickly as it did. And as a result of that, we needed time to get things in place. At the same time, I mean, COVID's been a major health concern, but we recognize that people are still having chronic health conditions like diabetes, for example, asthma, mental health concerns. And these are things that people will need to continue to see or speak with their physicians or nurse practitioners about. And we had to have a way to let people know that these services were still available. And we thought a visual map with a list of available resources would help people. It would be kind of a one-stop shop in order for people to be able to look and say, hey, I can access this service in this way.
So can you tell us about some of the services? I know that there's patient care, but if people have to, have blood tests or similar things like that, can you tell us a bit about that?
Yeah, you're absolutely right. We've tried to be as inclusive as possible as far as community medical related services are concerned. So certainly doctors' offices and nurse practitioners' offices are available on the map. Lab draw clinics, as pointed out. Also diagnostic imaging. So if people are needing an X-ray or an ultrasound to be completed in the community, all of the local providers are on the map. There are also some community specialists available, and recently we've added some physiotherapists as well.
Great. So how do people access the map?
Yeah, so to access the map, it's available currently on the ECMS, the Essex County Medical Society website, which can be found at ecms.org. And then to get to the map, right from the landing page, you just click on Available Public Services, and it will bring you to the map.
So there are some people that don't have internet connection. How would they be able to access it or find out where they can get some help?
Yeah, that's a great point. And fortunately, we've been able to team up with the Windsor Essex Community Health Center, and they have offered up a phone number that can be used for people who cannot access the map online to be able to call in to find out what the services available to them are. That phone number is 519-997-2827, and it's extension 339.
Great. And Jennifer, when patients are going to go, if you know, I'll give you an example. I'm a type 2 diabetic, so I have to get my blood work done every 3 months. Is there any precautions that patients should have when they do approach a clinic or go to the doctor that's specified on the map?
Some of the clinics are going to specify that information on the map, and some of them do not. I think for the majority of medical practices, we are not accepting patients just walking through the door, and that's on the advice that we've received in terms of how to keep people safe. I think most practitioners, and again, the information is available online, but most of the time now, a phone call ahead to ensure that people have been appropriately screened before coming into the office is what's being asked. And the reason for that is to help keep people safe and to help keep community members safe and to help keep the staff safe as well.
Excellent. Well, Jennifer, thanks. I really appreciate your time. Thanks for the development of the map. I think it's an excellent resource for people. And maybe do you want to just, let's get that website out again to access the map and also the phone number?
Yeah, well, thank you so much, Rob, for the opportunity to hopefully get the message out there. We really hope it is a useful tool for people. So it can currently be found at ecms.org, and then you click on Available Public Services, or you can contact 519-997-2827, extension 339.
Jennifer, thank you once again for coming on with us.
Thanks so much for the time. I appreciate it.